I just let it go. No, I know. Save our hospital.
Save our healthcare. Save our healthcare. Save our healthcare.
What do we want? 24/7. What do we want?
24/7.
What do we want?
24/7.
When do we want it?
When do we want it?
Now.
Together we rise for patient care. Big union. Together we rise for patient care. Together we rise for patient care. Woo!
Together we rise
For community care.
Together we rise for community care. Together we rise for community care.
So we tell them.
So we tell.
Sorry, Jill, if I hit you.
We are the union, SCI Union.
I want to thank all of you for coming out today. I want to thank Save Our Hospital, SOS. I want to thank Niagara Health Coalition. Everybody that's worked so diligently to make sure that we have what we need here to ensure that everybody in Fort Erie, and really everybody in Niagara, has the health care, the access to health care that they need. So when you think about it, I think most of you know that we have put together a proposal for Niagara Health and the Minister of Health to consider that would make use of this purpose-built facility, built to provide health care to the residents of this community. Now it provides health care to a lot of people who come in because they don't want to wait 4, 6, 8, 10, God knows how many hours in an emergency department. So they'll come here. And most of the time, this is the appropriate place, but sometimes they come here and they have actual emergency needs. That's a problem for us because then an ambulance has to be called, one of the nurses has to accompany the ambulance, so that shortens the staff here. But the reality is, there are many, many nurses and doctors who are prepared to work in our urgent care centers because they understand that a well-functioning urgent care center will take pressure off of an emergency department.
Sure. Yeah.
Our proposal calls for Niagara Health to utilize this facility to put in alternate level of care beds so that 130 to 145 non-acute care patients aren't occupying acute care beds. And that's at a cost of $1,200 a day when an alternate level of care bed could be $300 to $400. So right there we're helping Niagara Health to reduce its $27 million annual deficit. And we're also allowing them to make better use of the financial resources they're given. It will also reduce the wait times in the emergency department, help to eliminate hallway medicine here in Niagara, and it will save the region anywhere from $5 to $8 million by reducing the offload delays that EMS experiences when they get to an emergency department and they can't offload their patient because the emergency department is full. That means those ambulances can't serve the rest of Niagara, and it means those paramedics can't do their job because they have to wait. So from my perspective and from the town of Fort Erie's perspective, this is what we used to call a no-brainer. Or maybe if you don't have a brain, you don't get it. So you folks are all a big part of our solution. And I want to thank Wayne Gates for his intrepid support. He bothers everybody. He's on top of everybody. And I know he's letting me speak first because he wants to see how long I speak, and then he wants to double the time. So again, thank you everyone. this battle isn't over. On June the 9th, when I was told by Niagara Health's representative that this urgent care center was going to be closed for Fridays in July and August, and some of our long weekends, holiday weekends in Fort Erie, I said, this isn't over. This is not over, and it's not going to be over until we get exactly what we need and what we want. So thank you, everyone.
Anyways, good morning, everyone. Wayne's absolutely right, and I want to say to the yellow shirts, let's give a big hand for the yellow shirts. They've been fighting healthcare in Fort Erie for over 20 years. But what's changed over 20 years is we're growing. We're getting bigger. We're getting more seniors into our community. You know, by the end of this decade, there'll be over 30% of all residents that live in Fort Erie are going to be seniors. And what do seniors need? They need health care. Make no mistake about it. But this rally, I want to say, we need to come together as a community. And that means everybody come together as this community and fight this closure. And I want to say to SEIU, thank you for being here. They're the ones in the purple shirts. Give them a big round of applause for being here. Because you know what? Wayne's right. Niagara Health has been very clear. They're going to close this place. And we're going to tell them they're not closing our urgent care center. It's going to be open 24/7, and we're going to make sure it stays open. I talked to Ford yesterday about 3 o'clock, and I told him, you have to fix it yourself. He tried to pass me on to somebody else, and I said to him, you don't understand what's going on in Fort Erie. We're growing. We're more seniors. We have a lot of seniors that don't drive. We don't have public transit. You have to come into this community and save healthcare. But to the workers inside that place, like every day, they're going over and above. They're run off their feet. They're exhausted. They're not staying home. They're coming in because they care about their patients. They take such pride in the work they do. But who didn't take pride in them? When they decided to close on the weekends and the extra days over the summer, when, by the way, we have 100,000 extra people coming in this community for tourism, which is good, by the way, because that creates jobs. Did they go to the workers and say, how can we help? How can you help us? Can you help us get more doctors? Can you help us get more nurses? They said, go to hell, we're not talking to you. Well, they're going to talk to them now because they're here on the lines with us, fighting as hard as we are. So I want to say congratulations to all the workers. We respect you, we love you, and we thank you. Because if it wasn't for you, our moms, our dads, our aunts, our uncles might not be here today. So thank you for what you do. And to everybody else that's been fighting and fighting and fighting, don't give up. I've always said, I've been a union person my entire life, and I've always said, fighting back makes a difference. And it's making a difference, because we're putting heat on them. They don't like what we're doing. They thought we'd go away. They thought this would be all over. Well, it's not over, and it's not going to be over until they sit down and listen to the mayor, listen to the community, listen to you, listen to the workers, because that's what they're not doing. Because we have solutions, we can fix this, they just have to listen. So thank me aloud and say a few words. Let's stick together, let's stay united, and let's take Niagara Health and the province on. And everybody, if you know the Premier's phone number, give him a call and tell him how important health care is to Fort Erie. Thank you very much for talking to me.
No traffic lights.
5 minutes notice before they announced the weekend closures of urgent care to the staff and the members of the community. They had no plan for the members working in the urgent care. There was no consultation, no planning. Now there's no weekend care, nothing. Workers were left to scramble, and we had to come up with alternate choices that were not ideal.
Shame.
And they're doing this at a time when regional tourism spikes over the summer. We've seen reports that state in Niagara Falls area, domestic travel has been on the rise as Canadians rediscover their national pride. These closures are coming at the wrong place and at the wrong time.
Shame.
Niagara Health should bring the union and our members to the table so we can protect their jobs over the summer and ensure the region maintains access to urgent care.
All right, this is an open letter to the Premier and the Prime Minister and all members of our Government of Ontario, healthcare, as promised to all, is a colossal mess and quickly getting worse every day. Who would have dreamed that our elected leaders would arbitrarily turn their votes and their voters who trusted them? The Douglas Memorial Hospital and the Port Colborne Hospital were built for their communities by the work and donations of the communities, a well-run board of directors. We have a large trust fund. I gotta find it. And when they took us to court and took our Douglas Memorial Hospital for $1, yes, we were on the top of the well-run hospitals and debt-free at that time.
Yes, we were. Yes.
Now look at what we have. One, ambulances are not allowed to take you to Fort Erie. Our urgent care is having shorter hours and closed some days, like today. If you go to urgent care at 8 p.m., the doors are locked. If you call 911 and are picked up and taken to Niagara Falls, it takes hours before you get in. You can be on a stretcher for hours before being taken and seen by paramedics who have to stay with you. Once admitted, you're wheeled to a hallway where there's a bed-to-bed lineups with no privacy, none whatsoever. Few steps across from dying and contagious patients with warning signs up. The whole system is lacking the well-run system we had and lost. We need to get our community hospitals back to lessen the overload of emergency conditions like above, and not only our local people get their jobs back, stop the overpaying of transporting meals and laundry. It worked beautifully then, and we'll do it again. I was the patient, so I can say all of that, and I mean it. And I worked for this system for into the late 1900s.